Hello, my name is Dr. Ashish Bhatia, and I'm a board certified dermatologist and an associate professor of clinical dermatology at Northwestern University Feinberg School of Medicine. And today we're going to talk a little bit about the XLV Plus. This is the newest generation of a vascular laser by Cutera. And this has a very strong legacy behind it, and we'll discuss that. And I'm excited to tell you all about it. So when I began first using Cutera products, it was kind of by accident. My practice started in 2004. I joined a big multi-specialty group, and the first laser that I inherited was this legacy Cutera laser called the Altus. And it wasn't even called Cutera back then. It was the company that started initially, and it was started by engineers, and they designed this laser. And then later the company became Cutera. So we used to call this R2D2 because it was this small little machine. It rolled around anywhere, and it really was unbreakable. At first I didn't really use it a lot, but then whenever I needed a laser or one of my other lasers broke and I needed something for vascular or hair removal, this was always there, always reliable, and always available. So we really enjoyed it, and that's how it all began. So the XLV Plus is really multiple generations later. It's a dual wavelength aesthetic platform, and it really leads its class in its range of specifications and power, in spot size and cooling. And that way you can address pretty much anything you need as far as superficial or deep lesions, dark or red lesions. So it's able to really treat a huge number of conditions. It's a very solid state, efficient design machine. It's fast in starting up, and it's easy to use. There's no consumables or disposable. So let's look a little bit at the specifications. So really it's two wavelengths, 532 and 1064. 532 we use for more superficial lesions, great for red, also good for brown, and 1064 is definitely for deeper lesions. And you can see there's a wide range of powers that are available from very low to very high, very wide range of pulse durations, as well as spot sizes. And one of the best things about this is the cooling. It is adjustable to different levels, and we'll talk a little bit about why we would use those different levels. Also, there's 3 hand pieces with this, and you can see that on the machine. There's the Cool View hand piece, which has a sapphire cooling window, and the laser fires through it. There's the Genesis V hand piece, which is used for the laser genesis procedure. And there's a new Dermostat pencil, and that's used to trace out individual vessels or small lesions. And so that's the newest innovation on this machine. So why did they pick 1064 and 532? Well, those are the 2 ideal wavelengths for vascular lesions, but it turns out they're good for a lot of other things. As you can see, because it's absorbed by melanin as well, the 1064 and the 532, you can use it for both of those indications as far as pigmented lesions, brown spots, and things of the sort, as well as use it for vascular because it is well absorbed by oxyhemoglobin, which is the red curve we see. So you can really see 532 does a great job with the melanin. And then 1064 works well with melanin, but very well with vascular lesions, so oxyhemoglobin. So 1064 was really pioneered by Cutera. It was the gold standard in the industry. And that first laser I showed you, R2D2, the Cool Glide XL is what it was also called, was a 1064 only laser. And so it was used for vascular lesions as well as pigment. So hair removal is really good for that, and a lot of other things. So that has gone into the XLV Plus. It's the safest wavelength for treatment of skin, all different skin types. So you can use it in very dark skin types as well as light skin types safely. There's also a laser genesis skin revitalization procedure, which is kind of the gateway procedure for people getting into lasers. When people come in, they want a no downtime procedure, but you want to help a little bit with their microvasculature, fine lines and wrinkles, or even scarring. This microimpulse 1064 is great to do because it just takes a few minutes. There's no downtime. There's a little redness, goes away within an hour. of them leaving. So the other thing interesting about the XLV Plus is it's got a new crystal in it. And this crystal, the crystal is the lasering medium, which actually generates the laser light. And here it's called the LBO crystal. So unlike a KTP based laser, where the KTP crystal is generating the light, here LBO is what's being used, lithium triborate. And this is one of the more efficient, more powerful lasing mediums that can produce short pulse durations and really expand the range of what we can do with a 1064 and 532. In addition to that, it's extremely reliable. And what you get then going from the old KTP crystal to the new LBO crystal is the expansion of the fluences you can use and the different spot size you can generate. So with this laser, you get 50% higher maximum fluence, and you can get a 16 millimeter spot size. So what this gives you is versatility and high power in a vascular platform. So you can do very short pulse durations, high energy, and deliver therapeutic fluences at all different spot sizes. So what does that mean in reality? Well, if you compare the XLV to the XLV Plus, the window is 2.5 times larger. And so that allows you to do a full facial treatment much faster. Let me show you an example here. So this is a head-to-head simulation we did. And this was during Halloween, so I was dressed up as Mike Ditka of the Chicago Bears, and I accidentally hit the emergency cutoff switch. So don't do that during your demos. Now here's the real demo, and we're comparing the XLV Plus on our left and the XLV on our right. And because of the larger spot size, the more power, better cooling, we can cruise through a treatment in about 40% less time. So that saves a lot of time during the procedure. You can see I'm just kind of gliding along very quickly with the XLV Plus while I'm still trying to catch up with the XLV. And one of the interesting things that we found that was kind of a unplanned positive consequence of going to this larger spot size was actually less swelling after the treatment. And it's really due to the very efficient, powerful cooling system on the XLV Plus. Because it can extract so much heat out, it allows the vessels to be sealed off without just partially damaging them. And when that happens, you get less leakage of fluid into the interstitial space, and you get less swelling. And you can see that this was a patient, that same patient, an hour after the treatment, she sent me these pictures. You can see how much less swelling there is on the XLV Plus side. This is 14 hours later, and you can still appreciate a big difference in the swelling. Much less swelling, faster recovery with the XLV Plus. And finally, 22 hours later, once again, there's almost no swelling on the side with the XLV Plus, while the XLV side still had a little bit of residual swelling. So not only can you do the treatments faster, you actually get less swelling. And this is 22 hours later, both sides. So you can tell the difference in the edema. So in essence, we get a faster treatment, more comfortable treatment because the cooling allows it to be a lot more comfortable, less swelling after the treatment, and equal and possibly even better efficacy. This is another thing that's very unique about the XLV Plus is most lasers, when they fire, they actually don't fire a single pulse, even though it's telling you that there's a pulse duration of a single pulse. It's usually a train of pulses because the laser can't generate a pulse for that long of a period of time. While the XLV Plus actually has the true pulse technology, which allows it to fire one continuous pulse. And below, you can see the competition actually has to fire 3 pulses in the same time. So heat, cool, heat, cool, heat, cool. What happens when you do that? That's called a pulse train. Pulse trains are bad. You know why? Because they cause bruising. So this is an example of the 15 millimeter spot on the XLV Plus compared to the Candela Syneron Prima, which is the newer device after the V-beam. And you can see you get a lot more bruising, and that's because of the pulse train. Let's take a quick look at the results that you can see with the XLV Plus. So here's a patient after 6 treatments using the laser genesis procedure. And this is one of my favorite procedures. I didn't believe it that it actually worked until I actually tried it myself. So you basically keep the laser above the skin at a fixed distance. It tells you how far to go, to keep it away, because there's these 2 beams that intersect, and you know you're the right distance when the 2 beams are pointed one on top of each other. And you hold it at that distance, you just paint back and forth. And the micropulse 1064 actually seals up the microvasculature, getting rid of redness without swelling, erythema, downtime. And so it's a quick procedure. It's Dr. Bradley Bloom's patient after 6 treatments. Patient gets it done, truly a lunchtime procedure, and goes right back to work. Here's another treatment with the laser genesis, and this is really for 2 things: the post-inflammatory erythema and the post-inflammatory pigmentation after acne. Not only that, 1064 is actually good for acne itself. So it helps shrink the oil glands, but it also helps get rid of the microvasculature redness and the brown spots after people have had acne. This is after 6 treatments. These treatments are very quick. This might take about 5 to 7 minutes to do this whole treatment. We also use it a lot for scars, so keloidal scars or hypertrophic scars. So here's an example of a hypertrophic scar after a thyroidectomy surgery. And this was after 3 treatments. You can see it's shrunk the scar and flattened it and actually reduced the size of it. So now it's just a thin little white line. Here's another example of the Cutera XLV Plus being used by Vic Ross, and he used it here just to treat the little telangiectasias on the cheek. So these are those patients that come in with rosacea. Even with a single treatment, you get a pretty impressive result. Here, let's look at nasal veins. These are usually very difficult to treat. Well, the XLV Plus has that special dermostat handpiece, so you can actually trace these little vessels out, no cooling or gel required, and you can get rid of these little guys. These are one of my favorite things to treat. They're a home run every time. These are called venous lakes. And so we can treat these with 1 to 2 treatments. We can shrink these vascular lesions. And these make a huge difference in people's lives because they feel like they have this deformity or growth on their lip, especially for men. They can't apply lipstick, so they can't hide it. You get rid of these in 1 to 2 treatments for your patients. They're extremely happy. Very easy to do. Usually just a few pulses and they're gone. This is something we use it for all the time, and these are bruises. Now, we use it for bruises after filler and toxin injections, but you can use it after surgical scars too. So this is a person that had a facelift, had a lot of bruising in the neck, and you can actually see on the right here, they were just testing out to see how well this would work to get rid of the bruises. And 3 days later, after a single treatment with the laser, you can actually see where they actually hit and where they missed, and show the difference in improvement, whether you treated it or didn't treat it. What a big difference, and patients love this. We just throw this in and do this for free for them because it takes 5 minutes, and they're so thrilled that you made the bruising go away half as fast or twice as fast. And then, pigment. We use this once in a while for lentiginous. So on the back of the hands, this is after 2 treatments. And this is where you turn down the cooling, because if you warm the surface temperature, the laser light will get absorbed by the first thing it hits, which is the pigment in the lentiginous, which is very superficial. Absorbs it, the little brown spots turn darker and then peel off in a few days. And last, this is a person with combination problems, right? This is my former partner, Kelly Stankiewicz, and she did a great job. This is after 2 treatments. This guy had telangiectasias, rosacea, but also had these brown spots on the forehead, like Mr. Burns. And those things make you look older than you are. And so she treated those, and great results after 2 treatments. So on the top is the Genesis V handpiece. It does 2 things. It gives you that right distance that you need to hold it because of the aiming beams, but also has a temperature sensor built right in, so it never gets too hot while you're working. And then that pencil, the dermostat's below. And then finally, one thing new with the XLV Plus is another thing new, actually, is the green Genesis procedure. And we use this like the laser Genesis procedure, but just to get rid of brown. And you can see after 2 treatments, this is one of my patients, we were able to help improve that, the browning, very easy with no downtime. And this is another example of the Genesis Plus, Green Genesis procedure with the XLV Plus used to get rid of some of the erythema and some of the brown spots. So one thing that this laser has that no other laser has is amazing cooling. This cooling system can extract 3 times as much heat from the skin at the same time than the old CoolView handpiece did. And this is way better than any cryo cooling or any other type of cooling because this is true contact cooling. It's a heat sink that's sucking that heat out of the skin. So it keeps the skin very cool, which keeps it safe for the high energy laser treatments, but it also keeps the patient very comfortable. Also, has no consumables. So unlike cryogen cooling or air force cooling, you don't have any consumables here, which is amazing. And the last thing is the size of this thing, right? Here we have it next to a Prima, and it takes up a fraction of the size. So this is nice in any exam room. You can wheel it around. It's got real-time calibration, so you don't have to sit there and calibrate it even the first time you use it. You just take it out, you're ready to go. And it takes only 2 minutes to start up. Lastly, one of the beauties of the XLV Plus and that whole platform was that a lot of the settings for different indications are built in. So here we typed in that this patient had a type 2 skin and we're treating telangiectasias in the face. And it gives you the safe ranges to use with all parameters to get an effective treatment. So it's taken experts and taken all of that knowledge and actually put it into the interface, which makes it really easy for even a beginner to use or an advanced user to use safely and effectively. So now we'll take some questions. So our first question is, how does the cooling help improve the swelling? Well, what the cooling does is help extract heat. And when you extract heat, you get a lot less collateral damage from the laser. And so when the laser fires, the light is absorbed by the chromophore, which is hemoglobin, and it basically boils the blood to the point where it seals off the vessel. But when you have really good cooling, what ends up happening is it protects the tissue around it. And so you don't get partial damage to other little vessels or lymphatics, which will allow drainage of fluid from those vessels into the interstitium. And that's what leads to the edema. And so with the more efficient cooling and being able to deliver higher energies, you can very rapidly and effectively seal off the vessels. Second question, how are you using Green Genesis in your practice? So Green Genesis is fantastic. We use that to take care of a lot of widespread brown lesions where patients don't want a lot of downtime. They don't mind coming in multiple times, but they like a quick procedure that's painless and helps get rid of the brown spots in a slow, gradual manner. It actually helps quite a bit with poikiloderma as well. So those are the 2 areas we use that. Next question. What practice advantages does the XLV Plus offer? Well, one of the things the XLV Plus can do, which other lasers can't do, is it can treat up to about 40 different kinds of conditions. So, if you were to ask me what would be the first laser I would buy in my practice, it would be the XLV Plus, because we can use it on almost any patient, fair skin, dark skin, for lentiginous, for hair removal, for vascular lesions, and a variety of other lesions. So it really is one of the most versatile, and that's why we say B, XLV Plus, B for versatile. What are the main differences between the XLV Plus and a pulse dye laser? Well, we talked about some of those differences. One of them is the true pulse technology. It delivers energy over the whole pulse duration, and so it effectively seals off vessels without causing bruising. In fact, it's very difficult to get bruising with this laser. We actually tried it for a study we had to do where we had to generate bruising, and then we were treating it with a topical. And it was very difficult to actually generate bruising with this laser. The other thing it offers over a pulse dye laser is that it's got 2 wavelengths. So it's got the 1064 and the 532, while a pulse dye is typically 595 or 585, single wavelength. And so that allows a lot of different things to be treated. And then last, but most importantly, is the cooling. It has superior cooling to any other device, which allows you safer, more comfortable treatments. The other thing it does do is it provides a lot more comfortable treatment because there's not that burst of the cryogen cooling spray where the patient keeps jumping. And so we can even treat kids, such as port wine stains or birthmarks, with this laser. And the kids are very comfortable and they're not jumped or startled. And the last thing is that dermostat handpiece. That is one of a kind. It allows you to trace out little vessels individually very quickly and easily without any gel or anything else. And then finally, in addition to those two handpieces, we still have the Genesis handpiece, so we can do the Genesis procedure. Those are the main differences. And last question, what are some of the advantages of the adjustable contact cooling? Well, with the adjustable contact cooling, you can bring it all the way down to 5 degrees centigrade or as high as 20 degrees centigrade. And when you go up to 20 degrees centigrade, it allows you to actually heat up more superficial lesions but protect the surrounding skin. And so we do this for pigmented lesions such as lentigines. And we raise the temperature to 20, allows us to heat up those lentigines, they turn dark brown, they peel off. So having that ability to change the cooling gives you one more parameter you can use to customize treatments. Well, I hope you enjoyed this presentation on the XLV Plus. It's truly one of my favorite lasers in the office, and we use it every day. So if you have any questions, feel free to reach out to me over Instagram, Batia Derm, or email. Thank you.
Hi, everyone. This is Dr. Tal Humes. I'm a board-certified physician in the United States, and I have an all non-surgical cosmetic practice. Today, I'm going to talk with you about how I utilize XLV in my practice. Honestly, I love this device, but it's my most underutilized laser in my practice because I'm mainly using it for laser genesis, acne, and then combining it with picogenesis. All great treatments, but there's so much more I can do with it. And my takeaway from putting together this presentation and talking about this device is realizing that what I need to do is get back into my practice and start utilizing XLV for everything it can do. What we're going to talk about today are the three main reasons that I use it. So when we talk about laser genesis, this is probably one of my most favorite treatments we do. Not because the other treatments I do aren't great, but because pretty much everyone can do this treatment. I can treat all skin types. We have men and women doing this treatment. I treat a lot of different conditions with it, all with no downtime. So patients love that they have no downtime. It's not a treatment that hurts them. It can be a lunchtime laser treatment for them to either give their skin a glow or to treat a skin condition. In our practice, we also call this our Hollywood glow. We'll combine it with a dermaplane to help exfoliate the skin, then do the laser genesis, and then our patients are ready to go out, whether it's to work, whether it's to an event, what have you. And for us, that's the Hollywood glow in our practice. What we're doing with laser genesis is this is a micropulsed ND YAG. So it's a shorter pulse duration than what you see when you're doing laser hair removal, but not quite as short as your nanosecond or your picosecond pulse durations. In my practice, I always say we can treat pore size, texture, fine lines, wrinkles, and redness. We can also treat poikiloderma savant, as well as scars with this device. In addition, what I really love laser genesis for is two other things. One is skin health, meaning that our patients come in, they just want to overall have great looking skin, keep it glowing, and we'll utilize laser genesis. And then also for maintenance treatments. If I have a patient who's doing something, let's say an ablative laser like the Pearl laser, I will follow them up with laser genesis and put them on a maintenance package in order to protect their investment and keep their skin looking great. Who's a candidate for this treatment? As I said, we can treat all skin types, and that's because it's a 1064 wavelength on this laser. So with that long wavelength, we can treat all skin types safely. We treat patients, as I said earlier, for pore size, texture, fine lines, wrinkles, and redness. We also treat for skin health, and we tell them to come in and do about a series of 5 to 10 treatments. Now, does everyone do 5 to 10? No, we have some patients who, again, are doing maintenance, and they're doing 1 or 2 treatments afterwards, or they're doing something once a month. But if a patient is coming in and they want to treat one of their skin conditions with laser genesis, I recommend that series of 5 to 10 treatments, and I have them come in about every 10 to 14 days. I let them know that it's safer to do sooner. They could do it at a few days or a week, but most of my patients can't get in that often regarding their schedules, so every 10 to 14 days is great for them. I do treat off of the face, and I'll treat the neck as well as the décolleté as well, and I've had patients come in where we're treating either acne scarring or something else on their back. So it is a device that we can treat on multiple areas of the body. What I love about this image is it shows you how we can improve redness. So if you see this patient before, she has that diffuse redness that's seen on camera, and following a series of 6 treatments, you see that her overall redness has improved. So this you're going to see on, looking deeper into the skin, but as well as on the surface of the skin while you're treating them. Here's a patient who was having her redness treated. I love what we see here is not only has that erythema gone away, but look at her skin texture. Look at how much nicer that is because this device is stimulating collagen in addition to going after the microvasculature. Our acne patients, these are the type of patients who walk through my door. And I know they're the same type of patients who walk through yours. In fact, a lot of these are pictures of my patients. And when they come in and they have acne, it is so difficult for us to treat. Acne is one of those things where it is the most common skin condition that we see. I think we forget that acne is a skin condition. We just think about it as something people don't like. But it's the most common skin condition according to the American Academy of Dermatology, and it is something that plagues our patients. For many of our patients, it can cause depression, it can make them feel bad about themselves. And what we want to do is we want to treat it before they scar, because the easiest way to treat acne scars is to clear up their acne. With this, what I can do is I can treat them safely and effectively. It is not a very painful treatment for our patients. They have no downtime, and they have nothing that they have to change as far as lifestyle. What I do is I have them come in once every 2 weeks. We do the treatment. And with this treatment, what I'm doing on most of my patients, now keep in mind, this is if they're fits 1 through 3, I will treat them on the 1064 settings, and I'll place a device on their skin, and I will pulse it almost as if I was doing hair removal. So this is not a laser genesis setting. This is using our 1064 handpiece, placing it on the skin. I set it to 50 joules and 50 milliseconds with a 10 millimeter spot size. Now, if they're fits 4, 5, or 6, I do adjust my parameters more. But if you're fits 1 through 3s, you'd be you can definitely use that 50 and 50 from a setting standpoint. Here's one of my patients. She's a fits 3 patient. We treated her every 2 weeks. This is her after 2 treatments. What you can see here is that these pustules or those cysts that she has have started to improve. Now, I don't treat just on those pustules. I treat the entire cheek in that area, and then I'll go ahead and treat her other one. If there's no acne on the forehead, I don't necessarily have to treat that, but I try to take a look and see what is going on with their skin. The thought here is that this 1064 wavelength is drying up the P. acnes, the bacteria that causes acne, and what we're able to do is we're able to dry that up and reduce their acne. Will it last forever? No, I tell my patients are going to need maintenance treatments, but honestly, if you look at the patient before and then you look at this one, we're seeing different types of acne that have cleared up after 2 to 4 treatments, and these patients at 1 year follow-up were not needing more treatments. But I do always tell them they will need maintenance treatments for this. So we have a patient, she has more of an inflammatory acne. We're able to reduce that inflammation as well as go ahead and reduce the pustules. Here we have a younger patient, and in this patient you can see again cystic as well as inflammatory acne, and then some acne scarring. Now, as we treat this acne and we clear it up, we'll reduce that chance of scarring in the future. But for right now, we went ahead. This is after 3 treatments, again, spaced 2 weeks apart. This patient was also treated at 50 joules, 50 milliseconds with a 10 millimeter spot size, and we were able to improve that acne. This is a patient who doesn't like to wash their face. They're not taking good care of them. They're not using good home care products. And while I advocate for all of that, I like to have other options for them. Finally, here I have a young patient, 15-year-old, who was brought in by his mother because he just won't wash his face. He's playing sports. She can't get him to take care of his skin. And here we've done is we've, again, after 3 treatments, improved the overall texture, integrity, and acne on this patient. I will combine for those acne patients, but let me go back to that really quickly. I will also combine laser genesis with the acne setting. So what I'll do is I'll do acne treatments. I do a series of usually 4 treatments, but I tell patients they might need up to 6. And then I get them in a series of laser genesis, about 5 treatments. I do absolutely do them on the same day. What I'll do is I'll do the acne treatment first. And by the way, we do not use any numbing when we're doing that acne treatment. So I'll do the acne laser first, then I'll immediately follow that with laser genesis. Because I do find that laser genesis also helps with clearing up acne, because that 1064 is still targeting that bacteria. One of the other areas where I use my XLV a lot is combining laser genesis with picogenesis. I love this combination. We said earlier that our laser genesis will get pore size, texture, fine lines, wrinkles, and redness. But the thing it can't do is it can't get pigment. So oftentimes I have patients who come in and they want to get all of those skin conditions, that pore size, texture, fine lines, wrinkles, and redness treated, but they also have pigment. They also want to work on their scars. And while laser genesis does a good job of stimulating collagen to improve scars, picogenesis also does collagen remodeling for scarring. So I love to do that combination. In that case, which do I do first? I will do laser genesis first, immediately followed by picogenesis. Does it matter which one we do first within the treatment? And by the way, when I say do them first and second, I mean on the same day. It doesn't matter which we do, but that's the order that I like to treat my patients. Here you can see a patient who has acne as well as scarring. And you can see that that erythema has improved significantly. And then what we'll work on next is improving that scarring as well. So when our patients come in and they have a multitude of problems, I like to look at how I can combine my services. My reason for this is that in my practice, I always say, we don't sell services, we sell outcomes. So I ask them what it is that they want to treat. And then from there, I talk to them about how we can best achieve that goal. When I'm doing that series, again, what I'll say is I want to do a series of 5 laser genesis, and then I'm anywhere from 3 to 6 picogenesis, again, depending on what their problem is. What I'll do from a spacing standpoint is I will do laser genesis. Let's say day 1, I do laser genesis first, immediately followed by picogenesis. 2 weeks later, I do the same. You could also say I'm going to do laser genesis on day 1, immediately followed by picogenesis also on day 1. 2 weeks later, laser genesis, 2 weeks later, the combination. It depends on how you want to space it out for your patient and how many of each treatment you're doing. If I'm doing a series of 5 laser genesis and 3 picogenesis, doing picogenesis once a month and laser genesis every 2 weeks, it's a really great combination for them. Thank you very much, and I hope you have a wonderful day. Audio Jungle.